How is a core needle biopsy performed for lymphoma? Imagine needing a small sample of tissue from a swollen lymph node to find out if it's lymphoma. A core needle biopsy is a common way doctors get that tissue safely and accurately. The process starts with numbing the area around the lymph node using local anesthesia, so you won't feel pain during the procedure. Sometimes, imaging tools like ultrasound or a CT scan are used to guide the doctor precisely to the suspicious lymph node or tissue. These imaging techniques help ensure the needle goes exactly where it needs to go, making the biopsy more accurate. The doctor then makes a tiny skin incision if needed to help insert the needle smoothly. The needle used is hollow and wider than a typical needle, designed to remove a small cylinder of tissue called a core. Multiple cores are usually taken from different parts of the lymph node to gather enough tissue for a thorough examination. The entire process generally takes less than 30 minutes and is done on an outpatient basis, so you can go home the same day without staying overnight in the hospital. This method is preferred because it provides a larger tissue sample than fine needle aspiration, which only collects cells. The preserved tissue structure allows pathologists to examine how the tissue is organized and perform special tests like immunohistochemistry. These details are essential for accurately diagnosing lymphoma and identifying its specific type. After the biopsy, a small dressing covers the site, and you might feel mild discomfort or a pulling sensation, but significant pain is uncommon thanks to the local anesthetic. You should keep the area clean and dry for a few days and can take over-the-counter pain medicines if needed. Because it is less invasive than surgical removal of the lymph node, a core needle biopsy is often safer, especially for older adults or people with other health issues. Plus, since the lymph node stays in place, doctors can monitor it over time if needed. In summary, a core needle biopsy for lymphoma is a quick, minimally invasive procedure that provides enough tissue for accurate diagnosis, with less risk and recovery time than surgery. If the sample isn't enough or the results are unclear, a surgical biopsy might be recommended to confirm the diagnosis. Always remember to discuss your specific situation with your healthcare provider, as individual needs can vary.